Hello, my name is Mary Wilde, and I'm a University of Rochester professor at the School of Nursing, and that's in Rochester, New York in the U.S. Today I would like to talk with you about my research of self-management of intermittent urinary catheters is the name of the presentation. I also want to point out that I'm a member of the ICS Nurses Committee. The objectives of this presentation are to educate continence nurses globally to help to improve patient care. At the conclusion of this presentation, you should be able to describe an approach to intermittent catheter self-management using a web-based application, which is related to a recent research study of mine. You should also be able to evaluate its usefulness in promoting self-management in clinical practice or further research. The name of the study is a web-based self-management intervention for intermittent catheter users, and as you can see, this was funded through NIH, through the National Institute of Nursing Research. The names of my colleagues are listed here, and I wanted to tell you that there are several publications, 3 of which are in press now, and 1 is in review. They're all listed at the end of this presentation. I'm using the term clean intermittent catheterization, or CIC, in my description of this study today. After consulting the literature, I completed a qualitative study to identify issues and concerns of intermittent catheter users as I prepared to extend my self-management research to this population, who are similar to people with indwelling catheters. However, I focused the project on people just with spinal cord injury. This is a brief list of typical problems of people with intermittent catheters, including psychological concerns, worries about catheter-associated urinary tract infection, which we call CAUTI, inadequate insurance, and limited catheter choice. Bathrooms were also dirty and often challenging to use because of no place to put supplies. And often people who were in wheelchairs found them challenging because there was just very little privacy. You could get into the stall, but you couldn't get the door closed. Also, as in the Kelly study, I discovered that some individuals found pre-lubricated catheters hard to handle, and they just slipped, sometimes landing in the toilet. And people with difficulty transferring or getting into a bathroom may need the catheters attached to a bag. Insurance companies, which reimburse in the U.S., are sometimes not willing to pay for these higher cost items. However, if the person has a history of CAUTI, sometimes a physician can persuade the insurance company to allow purchase of the catheter attached to a bag. We also believe that a catheter attached to the bag can help people to get out of the home more and feel more comfortable because they won't have to find a place to empty it. This is a list of the aims and the goals of this study, which I'm going to be spending most of my time talking with you about. Essentially, it was a feasibility study, as I mentioned, for people with spinal cord injury who use CIC. Some of them were self-cathing and some had others assisting them. It was a feasibility study to test the acceptability and usability of the website applications that we created. Also was tested the preliminary effectiveness of the intervention, and we developed and tested new measures of intermittent catheter self-efficacy and self-management. Our overall goals were for the study participants to learn more about their own patterns with CIC, to obtain support and information for self-management, and to sustain it over time. I want to point out that the measures that were developed were only tested in a sample of 26 people, I believe, so we really don't have enough to be able to write an article about the development of those measures, but other people can extend this research further, and I'll tell you more about that later. The design was interventional, teaching awareness, self-monitoring, and self-management, similar to the approach I used with indwelling catheter users. We also used just a single group with pre- and post measures to evaluate how they did. We used a combination of web resources, including the International Consultation on Incontinence Catheter Products page, which was used with permission. We had some additional catheter products which might be useful, such as insertion aids like the penis holder for men or the leg spreader for women, and catheters attached to self-contained bags. We didn't recommend any specific project or products, but we were just trying to give people some options. A lot of people didn't know that there were other supplies available. There was also a 24-page web-based educational booklet based on my previous research, and a web-based interactive urinary diary with intake and output pages, journal pages, and more, which I will demonstrate in screenshots a little later. We had 3 phone calls with the study nurses over a 3-month period, and discussion forums were led by peers who were involved in our initial development phase. We had a group of 4 people with spinal cord injury who helped us during this first stage of the study to test all the study components and help us make revisions, and we used their suggestions. An article on this process has been published. 2 of the pre-testers became our peer leaders with the full pilot study of 30 people, and they moderated the forums with the help of the study nurses and the principal investigator, who was myself. The sample at baseline was 29 people. All had spinal cord injury. There were slightly more men than women, and the mean and median ages were close, 44 and 47, respectively. Their history of using CIC was wide, ranging from 1 to 39 years and a mean of 16 years. The sample was diverse by race and ethnicity, and they had more independent functioning than in the indwelling catheter users study, and they scored lower on the CAT score, which was 5.97, as compared with 7.75 for the indwelling catheter users in my study. All but one used a wheelchair, though. This next screenshot shows the first page of our Managing with an Intermittent Catheter educational information. The top menu shows the sections of the intervention website with the ICI product website link. You can see that it says Product Advisor. And then there's Commercial Products, which is the next link in the top menu bar. Educational Materials, Personal Data, Forum, Contact Us, Help, Log Out. From this personal data page, you can see that there are links. You'll see it says Links to Other Pages on the right-hand side in blue-colored font. It says Make I&O Datasheet Entries, Make Journal Entries, and View the Chart and All Entries. Over to the left, there's a place for people to write a weekly pattern so that they can get a better idea of what's going on during the week as compared with the weekend. This was a suggestion from one of the 4 pre-testers. They said that it really helps to understand how those patterns change and how you might not drink enough fluids on the weekends when you're out, etc. All the data in these screenshots are simulated data, meaning I made them up. You also notice that there is a place below that says Goals. There's a place to write goals in the little box to the right, the white one. And then when you write a goal, it becomes put into the left-hand column. You can edit or delete these. This is an example of the fluid intake and output entry page. You can select certain days to view when you want to do that, and those are showing up in that little box on the left. You see the dates, Wednesday the 29th, January 2014, and you see a couple dates highlighted there, and those then are placed, or they show up at the bottom, as you can see. For instance, you might want to see whether your intake varies on Fridays and the weekends, and you can just select those days. This is the journal page, and you can get to this page through the intake and output page, or even through the first page, where we had the weekly patterns that we showed you. Notice that we have 6 questions to suggest entry information that might help the person better understand what's going on. The date and time are programmed to pop up in a typical little calendar format. As you can see, it says MMDDYY, or you can click on the field and you can actually just see that date and click on it. We asked the person to write what was noticed on the left, and that's related to awareness and self-monitoring, and in the action box, what they think was going on and what they did about it. And so what was going on would be self-monitoring. Maybe they decided to keep track of intake and output for a few days because they noticed their intake was too low. Or maybe they decided to increase their fluids, say by a half a cup or something, for a month, and see whether that improved their situation. So they can save the journal entry or they can cancel it, and they can also go back to those at a later date. One person said to us about the journal entries, this is a quote, "For a new person, a journal like this would be excellent because then they have a basis to go on from month to month, from year to year, of how they felt if they were sick and if they had a cowdy or anything." The next page is an example of the journal page filled out, and notice the entries can be edited or deleted. You see the first one says, "Urine still doesn't look right, but not as brown as this morning. Still smells strong, but not as much mucus." And then on action taken, "Looking back on the list, I see that some of my fluids today have had caffeine. Will try for more water before I go to bed." So you can see that they can list whether they have had caffeine in their fluids. And we also tell them how much on that page. This is part of the summary page called an overview. This displays all the data in graphs or tables. There's actually 2 graphs and 2 tables. This information was too large for one slide, so I have part of it on the next. It actually contains all the intake and output and journal entries, so the page can be rather long, requiring some scrolling. But you can see that we have the output in orange and the daily input in blue. Well, the blue was fine with me. I tried to get them to at least make the output a little lighter yellow, but they weren't able to change this. This next page is a couple examples of the table and the graph that I mentioned. And you can see that the cathing frequency is on a line graph, but there's also the numbers are listed in the daily cathing frequency, and then the intake and output on the table above that. We had worked closely with the 4 pre-testing study participants who gave us feedback before the full pilot started with the 30 people. And some said it was hard to make entries on a mobile phone. They would sometimes lie down in the evening, put their feet up, and be ready to write down what they had for the day, and found it difficult to see. So we modified the website to make it more friendly for mobile phone use, and we had a special grant that was given to our team for that purpose. Those in the pilot study later on who used the mobile phone adaptation seemed to really like it. This is a summary of our feasibility evaluation. This is to determine whether our approach could be used in a larger study. Several people withdrew or were lost to follow up early. That's not unusual with website interventions. However, 26 of the 30 in the pilot study had nurse consultations for the intervention. Websites, meaning the recruitment site and the intervention site, there were 2 major sites, worked well. Participants had little difficulty navigating, and most posts were related to travel, insurance, medications, or treatments for spinal cord injury. Others wrote about different catheters that they found useful, and about vendors and that sort of thing, concerns about the risks of cancer or cowdy. Participants liked the intervention, including the educational materials, urinary diary, nurse consultations, and discussion forum. This is a summary of the results. The percentage catheterizing in the desired frequency of 4 to 6 times a day increased from 69% to 77% over 3 months, with a range that did not change from 2 to 9 times a day. Now, these were not significant changes, but we were happy to see there was a slight increase. Self-management, however, of the intermittent catheter, which was measured by our new scale, increased significantly. Self-efficacy, which is confidence to do certain behaviors, and quality of life scores did improve, but not significantly over time. However, we need to keep in mind this is a very small sample. Cowdy, leakage, and pain decrease, again not significantly. The measures performed adequately, but they do need further development in a larger sample, which would have more power. These new measures can be available by contacting me, and for future research can be done to help to develop them further. Increases in fluid intake was the biggest self-management change based on interviews at the end of the study, and we were most happy to see that. One person said, I'm probably more conscious of my intake of fluids than anything because I was the one that was really slacking on taking fluids, and I needed to. I needed to do something about it, and I just sort of was lazy. And after the second time we talked with the study nurse, I really cranked up my intake of water because I was not a water drinker. And now I'm probably drinking 36 ounces of water a day, and I've cut out carbonated drinks. Some people find carbonated drinks irritate the bladder. I don't know that there's very much research that's been done on this. This I found was a very interesting quote, and it helps to show that people realize that they need to have adequate amounts of fluid, but they also have to balance that with incontinence if they're drinking too much and not able to get to the bathroom. And that's one of the things that we focus on the intervention. In conclusion, we suggest further testing of this intervention in a multiple site randomized trial in spinal cord units in particular across the U.S. or in several countries, focusing on newly injured persons at the beginning of this research. However, other people experienced in CIC could be included in a large enough sample because they would be able to share their knowledge and tips for healthy living, and that can benefit other people participating in this research, especially in the forums component. In terms of further research, the web-based urinary diary could be compared with the paper and pencil version of it. Cohort enrollments of about 10 people are recommended for optimal involvement in forums, and that would be easier to do with a larger study. More information by individuals for logins and actions taken that would be captured by the information technology folks involved with this online research would allow for better knowledge of who gained the most and participated more. Evaluation of this web-based approach will require more use of it, and for more evidence of its value, more research. The U.S. National Institute of Research stipulates that the products of this research, like the websites or the urinary diary, can be used only for education and research purposes, not commercial companies. The ICS Nurses Group will be able to make use of these products and disseminate them on their website. Essentially, what you need to do is to contact me, and you can develop a contract through the Information or Intellectual Property Division of the University of Rochester. Copyright information and access will be made in that way. So if you've worked out a contract, you will be able to use and modify all the components of the self-management education programs, including the web-based interactive urinary diary site. A programming code will be made available through a no-cost contract. So please, if you're interested in extending this research or replicating it, contact me, and I'll have you in contact with the department at our university to give you a contract. That way we can trace what's happening over time. We expect that the future versions would evolve significantly beyond our original product, but it's important to have a contract. Thank you very much, and these are our references, and I thank you not only from myself, but also from the International Continence Society Nurses Committee. Bye-bye.